Assalamu alaikum, everyone. I'm Anum Essa, Senior Communications Manager at PEP Foundation. For those who are engaging with us for the first time, Promotion of Education in Pakistan Foundation, commonly known as PEP Foundation, is a New York-based public, nonprofit, apolitical organization working closely with Higher Education Institute in Pakistan. And this Facebook Live is the third episode of our discussion series, Conversations, which attempts to deconstruct issues related to the higher education system of Pakistan. Today, we'll be talking about the assessment methods and strategies used at our universities and how they impact students' learning. I'll introduce you to our guest and our panel for today. Our first guest for today is Dr. Noman Abdullah, who has a doctorate in education and is heading the Department of Education at Virtual University of Pakistan. Dr. Nauman specializes in higher education and has written several research articles on the subject, which have been published in national and international journals. Thank you, Dr. Nauman, for joining us for the second time. Next, we have with us Mr. Muhammad Hussain. Hussain is an assistant professor at the National College of Arts, Lahore, where he teaches research and product design development. Previously, Hussain has done his master's in interaction design from the University of Sydney as an Australia Award Scholar. Thank you so much, Hussain, for joining us. And last but not the least, we have with us Maira Pasha. Maira is our final year BDS student at CMH Lahore Medical College, and Maira is here to represent the students in this conversation. Thank you very much, all of you, for joining us today. I will just get started with the questions. My first question is from you, Dr. Nauman. Since you've conducted extensive research in the field of education, according to you, what role does assessment format play in students' learning? Over to you.
Thank you, Ms. Anum, for having me. It's a pleasure working with you. There are different forms of assessment, and I think every type of assessment helps and it plays a significant role in the learning of students. Not only it helps in identifying the gaps, that is a function of formative assessment, but also it helps us in evaluating the performance. That is a function of summative assessment. Parallel with these, I think the key role of assessment is to diagnose the learning gaps of the students. Diagnostic assessment specializes in that. So I think there are different forms and different types of assessments, and all of them play a key role in the learning of students in one way or the other. That depends on the objective of our study program, mainly relies on the objective of our degree program. So there are certain limitations that assessment cannot go beyond that umbrella of a degree program or a study program, for instance. So, but in a nutshell, I will say that yes, assessment and learning go hand in hand.
Thank you, Dr. Nauman. Over to you, Hussain. Now you're an assistant professor of interaction design. As an assistant professor, are you given adequate resources and liberty to design assessment that evaluates students' creative and critical thinking? If you could briefly explain the assessment formats with this audience and how they kind of help you in doing so.
Yes, definitely. Thank you. My pleasure being here. And first of all, I'd like to explain what kind of teaching we do at the National College of Arts, and especially the fact of the matter is that we as a faculty are extremely different from the other faculties that exist. We basically teach design, arts, and architecture, which are in itself very different study areas than other areas that are more theoretical. So our study is more inclined towards studio and practically based classes. And as one of our other guests, Maira Pasha is too. She's studying, I think, BDS, which is mental education. I know a little bit about that too. However, we basically, most of our classes are studio based. So we tend to focus on practice more than the theoretical side. We do give education on the theoretical side, so that the students learn about research and theory of all of the studies that we do. However, we do tend to focus more on the studio practice. So in studio practice, the evaluation and the assessment is actually mostly subjective. So whenever there's the format that we use is basically juries. Whenever there's a project, mostly the work we do is project-based. So if, for example, the semester starts and we hand over the first project, after that, after 2 or 3 weeks, there's a jury. And people come from outside, professionals, teachers, academics, they come from outside, mostly 3 to 4, and they assess the students on their development, whatever they've done. And I have some examples if you want to, if you guys want to look at. I'm going to share my screen here. So I'm going to just briefly go through, obviously Dr. Saab explained all of the different types of assessments. However, we as academics in the design field, we don't really tend to go over assessment in so much details. However, we do tend to go into details of our own subjective and subject-based assessment. So this is one of the assessment formats that we used, that I basically created when I was here in Pakistan before going to Australia for studies. And this is basic format, which is divided into 3 areas. First, research part, where we assess the students' research abilities, in which we assess and gauge how he has understood the design brief and how he has identified different kind of problems in a particular project. And after that, the design development, which includes concept development, sketching, detailing, prototyping. So these are very, very studio-based and practical things. They are only assessed through subjective and qualitative. And the third part is the execution, presentation, and how the student speaks, how the student has visually prepared their presentation. So format, which I used before going to a grading criteria, and we follow it is done by ourselves. We can tweak it, we can change it totally, depending on the fact that how we are learning about the students and the students' work. But the grading criteria is set by the institution. We have to follow that. So this is kind of the crux of the whole situation of assessment right now. However, I do want to discuss how I have changed things. I went to Australia and I studied there, and I learned a lot over there. So when I came back, I totally overhauled the whole assessment format.
I'll just stop you over there, because that would be basically my next question, as to what kind of changes you basically incorporate when you returned after completing your education in Australia, and what were the changes that you felt yourself as a student. So we'll be talking about that shortly. But before that, I will move on to Maira. And Maira, you have heard the responses of both one of our assistant professor from education and one professor from the instructional design. As a medical student, of course, you have a different type of assessments, right? And personally, what are the kind of assessments that you learn the most from? Are there, any assessment that you feel are sufficient to assess your creative and critical thinking?
Assalamu alaikum. Thank you for having us. To answer your question, the main assessment system that I particularly think is beneficial for all students, including the medical students, are the practical-based assessments. So the assessments in which we give war tests or we give OSPs. OSPs are practical exams, and as well as clinical exams that we give. Those are the ones that benefit us the most because they test what we actually learned and what we're going to practice eventually when we step out of the university and into the real world. So those are the exams that actually build our skills and they make us into the doctors or into the professionals that we are supposed to become. The theory part of the exam is also important because that gives us knowledge and all the basics that we need to incorporate into our clinical work, but the practice that we get through doing it on the patients or to when we're actually doing it on hand, that is the one thing that actually builds the skills, and that is the one thing that will eventually help us in when we're going to be performing these in the hospitals or in a clinical situation. Other than that, it is very important to incorporate these kinds of activities, whether they be examination through the examination point of view or through general quizzes or general. We have end of rotation tests that we perform after every rotation that ends, and I think that is the one test that truly benefits the students as a whole in the medical field.
Thank you very much, Maira. Coming back to you, Dr. Noman. Now, you're a professor of education, and education is somehow assumed to be a subject that might not rely a lot on practical kind of assessments, right? As a professor, what kind of assessment formats do you mostly rely on? And is education even the kind of subject that could use some innovation in assessment methods to stimulate students' critical and creative thinking? If you could talk a bit about that.
Thank you again. I think we have to say that assessment types and forms of assessment depends upon the subject we are teaching about. It is not only about the education degree program. Even in education degree, once we are teaching use of ICT in education, we can use problem solving and practical based assessments. So and that is a function of a subject that we are dealing with. Talking about education as a discipline, I think yes, we do take assessments on different forms, ranging from objective to subjective to problem solving to practical exposure type. But the major focus is definitely on paper and pencil test in any university setup that is offering a degree program recognized by HEC, and that is not of a medical or engineering based system. But even those systems do also have paper and pencil test in some form. So talking about the critical thinking and creative skills of the students, there is a room, but that depends upon how the teacher is teaching in the classroom. The philosophy of the teacher and the approach under which the institution is taking its admission is most important. If we are following the philosophy of teacher-based learning or student-centered learning, these two are different ball games. So for teacher-based learning or teacher-centered learning, paper and pencil tests are the most reliable forms. But in student-centered learning, there are different forms which include essay type writing or problem-solving skills or practical-based. That also includes collaborative work as well. So I think one assessment type does not fit all. So there is no hard and fast rule even in one discipline. That depends upon the philosophy of a teacher. That depends upon the nature of students in the classroom. That depends upon the margin in the subject area. And then it finally depends upon the degree program the institution is offering. So these are the few things that determine what kind of assessment and what outcomes from that assessment can be taken. Thank
Okay,
you.
all right. Very well explained. Thank you. Now, coming back to you, Hussain, you already mentioned your experience in Australia and how it kind of helped you in shaping your assessment strategies here in Pakistan. Now, going back to your student experience, uh, what kind of changes did you experience in terms of assessments and evaluation methods? Because you did your undergrad from Pakistan, from NCA Lahore, and then you moved to Sydney to pursue your master's. So as a student, what the changes that you experienced in terms of assessments and formats, and were you able to apply or incorporate any of those learnings teaching, teaching here at NCA?
Yes.
Over to you.
Um, Actually, right here, when I was a student, the assessment format was literally extremely minimal. I felt that there were a lot of areas that that our teachers did not focus on, because there were a lot of students who were from underdeveloped areas, and they were from schools that were underdeveloped. So when they came in and studied at the National College of Arts, they couldn't compete with the students who were from a privileged background. So usually the privileged kids did a lot better in their exams or their project presentations, because they were trained in the art of presentation. However, the students who were from underprivileged areas and underprivileged schools, they did a lot of hard work, they did a lot of good work, but they couldn't present as well and they couldn't speak as well. So what our teachers did back then was that they did a lot of subjective assessment. So as I said before, our projects are very qualitatively assessed. So if I give you an example, uh, um, recently I gave a project. I'm going to share my screen so that I could show you a rubric that I made. So this was a project which was about a potato peeler. So this is usually our projects. It's about car design, it's about potato peelers, it's about a bicycle design. So the variety of projects are like this. So if you're designing a potato peeler, a particular student whose hand skills are very good, who can draw well, who can prototype well, they can prototype well and bring the product to life. However, when they're presenting, they can't present well. So this is something that I always felt that was lacking here. And usually teachers at the last day of the project, when the kids are presenting, they used to mark and grade the students, which is obviously absurd. However, when I went to Australia, I learned that the assessment is done stage by stage, phase by phase, and it's not done at the last day at all. So that was one point that I figured that that was really important. Furthermore, there was detail, attention to detail, because when I was here, as I showed earlier, I used to design a particular assessment format like this. There is no detail. Uh, there is no sub-level of the levels that are mentioned here. However, when I went there, they used to give us assessment criteria and evaluation criteria that were 2 or 3 pages long, and everything was done in a lot of detail, and it was extremely amazing. And somehow I thought they were just fooling us, but those teachers were so immaculate and so meticulous about grading that I felt that I mean, I have to do this when I come back. So I came back. I was immediately given the fourth year thesis projects, and I was supervising the undergraduate thesis. And I immediately designed a um, uh, assessment criteria, which was not only, and this is a simple example that I use, and I'm not going to go in details, but however, I mean, I jotted down that if somebody's failed, what is the project going to look like? If somebody has a distinction, what is the project going to look like? What is the problem? What is the issue? How are they dealing with it? What is the background and literature review? What were the methodologies used? And obviously, all of them were divided into phases. Like the thesis would carry a certain weight, and after that, the proposal presentation would carry a certain weight, and then would be judged based on these detailed rubric. So this is a particular change that I brought to the assessment criteria, and I
you very much for your response. Maira, you're up next. Now, I would ask you a bit about collaborative learning. And do you feel like during your
it
BDS degree, did
improved
you
a
get
lot of
okay, I
a
presume
lot
you're in the middle of answering the question. Sorry, Mr. Hassan, we just lost you in the middle. Are you done? Are you done with your answer? Should we move on to the next speaker?
yes, I think I'm done.
Okay, because I think there was a bit of a technical hiccup. Okay,
Okay,
so yes,
I think
Maira, coming back to you again. Um, so yes, we were talking about collaborative learning. So I would ask you, like during your time as a student, and you are still in your final year, do you get a chance to be part of collaborative group projects, and how different do you find them from regular assessments and projects? What kind of learnings do you draw from such projects?
We do get to be part of group projects, and in a way that we practice our clinical work. We have clinics every day, and we have different rotations. So in some of our clinics, we do it as a group, like 4 people will be doing one patient and learning together. And other than that, we do presentations, we do clinical case presentations and all of that. It helps us in a way that it improves our communication skills, it improves our team building skills, and generally it helps us at understanding how in the future, when we are going to be working in a professional setting, we're not going to be working alone, we're going to be working in a team. And through these projects and through these activities that are performed, we learn and we gain experience, we gain the kind of experience that we will be able to apply in the future, and they are going to help us into becoming better professionals. Because individually, the assessments that are taken individually, they test your own personal skills, but the tests or the assessments that are taken in the group, they test your skills of the professional skills, they test your actual clinical skills. And through those skills, you will be able to do better patient interactions, better general other colleague interactions, and it helps to build a better profile of your own towards the audience, towards your patients, towards everybody who is going to be interacting with you. And it also helps build a better profile for them to, if they want to recommend you to somebody, it's going to be beneficial for you eventually. So being a part of group projects, or doing these clinical cases, or doing general patients together with your team, it helps you become part of a close knit group, and that group is going to be helping you develop social skills as well as better communication skills. And I think that is more required in our field than our individual skills.
And are they more fun and more enjoyable as compared to the traditional assessment?
Yes, they can be more enjoyable as well, because when you're working in a group, you get to interact with different people, and you get to interact with your colleagues, your patients. So it is more fun and more hands-on, and the more hands-on your work gets, the more you get to learn from it as well. So it's like a win-win situation.
Good to know that. Now, coming back to you, Dr. Noman. Now, we talked about the formative assessment and the summative assessment, and also the traditional assessment method, which is like pen and paper assessment method, and as opposed to the innovative methods that can be incorporated in certain cases. Do you feel that the traditional methods are still necessary and still should be used in some cases, or you feel a combination of both innovative and old assessment formats should be adopted to maintain a balance? If you could share your thoughts on it and give us some rationale as to why one assessment method should be preferred over the other.
Thank you. I don't think there is any harm in continuing the traditional methods as far as it is achieving its purpose. And the purpose is to increase the learning and is to evaluate the learning of the students. But since the time is changing and post-COVID, we have learned through the experience of COVID outbreak that the different types of assessments can be gelled in together in the Pakistani context as well. And students can learn even better in those unorthodox assessment types, and as far as it achieves our purpose, there is no harm in blending the two types of assessments as well. I think that old assessment is a traditional form. It gives a sense of accomplishment to a student when he or she gets a result based on the performance. But talking about the collaborative nature of the world that is getting due to the advent of technology and the excessive use of technology, the collaborative part also needs to be inculcated in the overall assessment scheme. So heavy portion must be given, at least 50% must be given to the projects and collaborative nature of the assignments. The teacher plays a significant role in that. No HEC or no regulatory body refines you or restricts you to any one assessment method. What they require is that you do take assessment, and you do give the grades to the students, but that the learning must continue through every learning activity. So I think it is high time that we introduce no assessment system, especially based on the 2 years experience of COVID. There have been many different types of assessment that have been tested by the teachers in the COVID times. So it is now high time to continue those practice in the real life settings as well. Thank you.
Just a subsequent question. When it comes to the retention of knowledge, do you feel that the students are able to retain knowledge in a better way when they are assessed through innovative methods, or do you still feel that traditional methods are a better way of aiding their learning?
We cannot say that because that has to be compared with the objective of our assessment. If the objective of our assessment in an unorthodox style of assessment was to check the retention knowledge, then I think we will be better able to compare the two things, because in paper and pencil test you do get the retention and lower order learning skills of the students. But in every practical approach, we do not rely on the lower order thinking skills. In fact, we rely on the higher order learning skills of the students. So the two cannot be compared on one scale, because the objectives of the two assessments changes altogether.
Okay. Thank you very much for answering the question in such detail. Hussain, can you hear me now?
Yes, loud and clear.
All right. Okay, great. So just a few last questions. I'll talk about the students' feedback with respect to the assessment method. You know, there's often a policy where the students are asked at the end of the session to kind of review the taught material and also the assessment methods. What kind of feedback do you receive from students on the assessment methods? And if you do kind of conduct such an assessment or such a feedback mechanism at the end of the session, does it guide your assessment strategy for the next academic session? And what are some of the methods that students particularly enjoy and learn from?
I think progress, progress evaluation, and I mean, usually students really complain about getting really low marks. Other than that, they don't really care because they're students. The teachers have to actually make sure that they are going ahead, not really standing still. So their feedback is usually in Pakistan, the system is so broken that, you know, there is no proper communication. So I faced this problem a lot because the student feedback is not shared with the teachers. And it's a really bad thing. The formal way of getting feedback from students, um, um, it's not shared with the teachers properly. So, but we do ask students inside the class how they're feeling, how they're um, doing, and usually we every project. I mean, in a semester, we give them about 4 to 5 projects, and they're weekly or monthly projects. So we get really immediate feedback from them, and our feedback is also transferred to them. So it's sort of a good way to keep going.
Okay, and just another follow-up question. Do you feel that the group projects and these kind of collaborative learning, they kind of help student in a better way to uh, polish and
Yes.
polish and fine-tune their skills?
Yes, I'm a really huge fan of collaborative work because here in our education circle, nobody talks about collaborative learning. Nobody talks about group assignments or group projects. However, when I keep talking about University of Sydney, but it was so special because when I started to work in groups because ultimately you are going to work in groups when you're working in a hospital, when you're working in a multinational company, you're going to be working in a group. You know, a designer, we train designers, so a designer is not ever going to work alone. So in a group assignment, you not only learn from your peers, but you also learn the team dynamics, and that is extremely useful. So regardless of the assessment formats, collaborative work is the way to go. I mean, it's necessary.
Thank you so much. And I also feel the students do get a chance to learn from each other as well. Like there are certain perhaps topics which student might not have understood probably in the class, let's say, but I think they would be in a better position to ask the same questions from their peers and learn from what they have understood and what their peers have understood. So I think we're all here, you know, we all fully support collaborative learning, and we feel that it should be integrated in the regular assessment strategies as well as in like the student day-to-day activities as well. Now, Maira, over to you. Your assessments basically rely on theoretical as well as the practical components. And since you will be one day out there, you know, practicing as a doctor, do you feel that your experience, as per your experience, the assessment methods are in line with the practical world and real life scenarios? Or is there a disconnect that you feel that students would face when they enter the profession?
If I'm being totally honest, I feel like maybe most probably they will. Um, that is because the teaching methods and the theoretical books that we are being taught, they are being taught since ages, since forever. Maybe the doctors that are now working, and they're like, it's been 50 years they've been working, they have been taught the same books that we are being taught right now. Even though new editions come, new things are added to it, but the main theory of it is still the same, which is also okay, because that's the main theory will always particularly be the same, but maybe the teaching method, the way that it should be incorporated into our teaching criteria, it should be a little different. And since that method has not been changed in the past few years, I feel like that may be outdated in today's world. Considering that I am a medical student and we are being taught through lectures and through our practical work as well, our lectures, the theoretical part of it, sometimes feels like it's dragging on, and it's not helping us that much, because most people, they don't have that big of a hold in like listening to a lecture and capturing it all. So I feel like if there are some changes that are required to be made, and it will take a lot of time for those changes to be incorporated, but like to engage the students and to actually make them learn what is being taught, that is a very difficult task in the kind of way we are being taught. Like delivering a lecture and then asking a few students a few questions and then expecting everybody to understand the entire topic, I don't think that is justified in any way. I mean, yes, of course, it depends on the students as well, that like the attention span, the general seriousness they have with it. But if we're going to be if a teacher is delivering a lecture to maybe 80, 100 or 150 students which are present in a one medical class, I don't think they can expect 150 students to react in the same way, to understand or capture the information delivered in the same way. And if we move on to the practical side of this, you're dealing with patients, different patients come, and you apply the same things that you have been taught in class. So in class, the things that you have been taught, they are the most conventional and the theoretical things, that those basic cases that are being taught to you every day. But if those same cases that come to you every day in the clinic or in the hospitals, if they are taken and they are incorporated into your every lecture or into your every topic, I think that will help the students in understanding it better. I particularly understand a topic more when I have actually practiced it in my clinic. Like if a patient comes to me with a specific disease and then I read about it, or I'm taught about it in class, I understand it more because practically I have seen it happen. So that is the one thing that is lacking in our education system, that the teachers, or generally we expect students to grasp the theoretical part and apply it directly to their clinical part, which is not fair to them. I don't think that's fair to them. If the teachers come and they guide the students particularly about the theoretical part and how to handle the practical area through that, by applying every step and then showing it in the recent cases, I think that will help us as students understanding it better and applying it in the future in our own professional settings. So it will make us feel disconnected. Like if I'm talking about some of my peers who have graduated and who are working in clinical situations right now, I in discussions with them, I am informed that we understand much better now what we didn't understand back in maybe third year or fourth year when we were being taught this. And maybe if back then we were shown this case, maybe we could have understood it back then. But because we weren't shown this case and we weren't shown the practical, the real side of it, we did not understand it back then. So it's like a waste of that 1 year, maybe that 1 year when we are studying a multitude of cases. Theoretically we're studying them, but we're not seeing them in reality. Maybe all of it is maybe 1%, or maybe more of it is going to waste. So if those things are incorporated right when the lecture is delivered, it will save time, it will help the students learn better and faster, and it will eventually make them better professionals. So I do believe that our systems need a little upgrading.
Thank you so much, Myra. I mean, it's interesting to see how there's like a contrast between different fields. Like we've talked to an expert in education, then a professor of interaction design, and then Myra, who's a medical student, and how each sector has a different requirement when it comes to assessment and when it comes to incorporating new strategies in the existing assessment formats. Now, I would really want to end this conversation on a kind of a promising note, and would really request you all, since you all belong to fairly different fields. So, what are some of the strategies that you would suggest incorporating in the existing assessment methods that could trigger students' critical and creative thinking? I will start off with Dr. Noman, then Mr. Hussain would answer the question, and then I would move on to Myra. Over to you, Dr. Noman.
Thank you. Uh, I would say that the only thing that we need to do is to start teaching in a way that inculcates critical thinking in the students, and only then we can assess them, because we cannot do assessment of a thing that we haven't practiced in the classrooms. So in order to achieve those 6 C's which PEP is focusing, we have to advocating them. We have to launch campaigns in advocacy of those 6 C's that the teachers need to practice in our classrooms. So only then we will be able to design assessment schemes, assessment forms, assessment types to assess the students on those 6 C's, and especially critical thinking. That is the most important thing of those. Thank you.
Thank you, Dr. Noman. Over to you, Hussain.
Okay, so I would say that I would actually second Myra, Miss Myra, for what she said, that the systems are so much broken here in Pakistan that you can't really figure out what to do in an educational institution. You actually figure it out when you get out of the institution and learn for yourself, actually in the field. So what I propose is for practical-based subjects, what I propose is, and obviously I'm working on it as well here at the National College of Arts, that we are trying to bring the industry in the assessment process. So we are not going to, I mean, what we are proposing, what I am proposing is that when a student finishes 4th year, they can go and work in the field, and in the industry, people will assess them alongside the academics in the institution. So whenever they say, okay, they're going to get a degree, otherwise they're going to have to redo it. So this kind of assessment will make sure that industry-ready professionals are coming out of an institution rather than just theoretical learners who are untrained in the practice.
Okay, thank you. Myra, before I move on to you, Dr. Numan, just a follow-up question. In the field of education, are there any mechanisms where students are kind of asked to intern or volunteer at different schools so that they can kind of practice their skills? I'll then
Well,
move on to
yes.
Myra.
Okay. Well, yes, we do have different types of practical subjects. For instance, if I talk about an honors degree program of almost 130 credit hours, so 18 credit hours out of those are of practicum, and adding research component to it, there are 6 more credit hours to it. So almost 24 credit hours out of the 130 plus credit hours are exclusively of practical nature. So I do understand that academia, industry linkages, and practical and problem solving based approach of assessment. But first we have to teach the students in that way, and only then we should practice in the assessment in that way. I'm giving the perspective from the teachers, what the role of teacher is needed in the classroom, and then we can rely on the assessment. Assessment alone, it is very easy to say that merge these 2 things, fix these 3 things, but it is not a practical solution unless we start teaching them in the classrooms. Thank you.
Thank you so much. Now over to Myra. Any recommendations, any suggestions that you would like to give?
In regard to the previous answer that I gave, I think that maybe like incorporating the clinical cases into our teaching methods can help us in learning all of those things better. But if I'm talking about the assessment point of view, I think that if we I think you would also agree, and most of the people who are in this education system in Pakistan would agree, that there is a certain degree of specificity that people expect in your answers. When you're attempting a question or attempting an exam, there's a certain type of specificity that is required. And I think if that specificity is removed from the requirement, it can help the students explain their point of view and their learning better. Like if I give you an example, for example, if you're asked a question regarding an explanation of a certain, if I'm talking about myself, a disease, or if I'm talking about computers, maybe a programmer. So, so the teachers, the examiners, they expect us to write the particular thing that is written in the book. And I think that is where the flaw comes. I think if they expect the students to write exactly what they understood from reading that particular stanza or that particular paragraph, and write that down, and then they assess that, it will help them understand the students better, that what the students are how the students are perceiving this information. And it will also help the students explore their own selves, their own critical thinking, their own creative thinking. Because if a student is taught to just write what's written in the book, I don't think that will help them learn or explore their own selves, use their own minds, use their own creative thinking, use their own experiences through their cases to incorporate that in answers. So the main thing that would benefit them is if they are required, or if they are required to present their own point of view or what they have learned from that particular topic, or that topic or of discussion.
Thank you, Maira. And I think it takes us back to what we discussed earlier. Like, I think it's very important for students to engage with the taught material critically and creatively in order to come up with an answer of their own, or perhaps an understanding of their own, so that they could retain the learning and retain whatever is taught in the class in a better manner. With this, we come to the end of our discussion, and I would like to thank all of you for such insightful responses, and thanks a lot for engaging in this discussion. And I hope the ones who are watching us at home would learn a lot from this discussion and would try to, of course, from now onwards, kind of critically engage with whatever is taught in the classrooms. And perhaps we can hope to bridge the gap between the practice and theory. To the viewers who joined us today, I hope to see you all next week. Thank you all. Thank you all the panelists. Thank you all once again for joining us. And I'll see everyone next week. Have a great weekend, and Allah Hafiz. And Ramzan Mubarak to everyone watching. Thank you so much. Allah Hafiz.
Thank you.